Well, hello everyone. We have Dr. Alanzi with us to talk about kidney stones and your that's easy for me to say, urological health. There we go. Thanks for joining us, doctor. Well, first tell us a little bit about what kidney stones are and how they form.
So thanks for having me, Chris, today. Kidney stones, unfortunately, are very common, and especially with the lifestyle we have nowadays, with changes of maybe the increased temperature increases the chances of kidney stones. So kidney stones are, in a nutshell, minerals are precipitating in the urinary system. So they oversaturated. There's high concentration of minerals in the urine, and they precipitate in the kidney, and with time they form a stone. And then that stone sloughs off and moves down the urinary system and down to cause a blockage, and that causes the most common symptoms of kidney stones, which is severe pain.
Right. So I was just going to ask you, many of us have heard of kidney stones, and they, of course, can be quite painful. And so I was going to ask you what some of those symptoms of kidney stones we should be aware of. So you did say they're quite painful, right?
Correct. And unfortunately, you're not going to miss that. Once you have the pain, you can tell. I have some ladies telling me it's worse than having a childbirth. Like it's really very painful. Saying that pain is the most common, but not necessarily the only symptom you have. Sometimes you can have just a discomfort or a dull pain, we call it, just like something is not right. Sometimes it can start with the blood in the urine or an infection. So if you feel something is not right, please reach out and ask for help.
Right. And then what kind of complications can come from untreated or recurring kidney stones? Like what if you don't treat it? What can happen?
Sure. So we unfortunately see some patients, they have pain, then they take something for pain, and then it goes away after a few days. Then they show up, let's say a year after, with like the change of their kidney function. They're losing some of their kidney function or infections. That's more common. And the more common complication is actually recurrent kidney stones. They will have them over and over because these usually kidney stones most commonly related to lifestyle, and if you don't change your lifestyle, it will come back.
Right. Now, if someone is experiencing reoccurring kidney stones or maybe suspects they may have kidney stones, now, how can you help them manage their condition or maybe even address their concerns?
Absolutely. So we go over just a general screening, ask them about their health, what the medications they take in, medical problems they have. Sometimes people they think they're doing the right thing by taking supplements. High concentration of vitamin C, for example, is good, and it's common nowadays. But if you take it for a prolonged period of time, it can result in kidney stones. Calcium, too, calcium supplements, if you take a lot of it, it can contribute to kidney stones. So we go over that. We ask them for family history, too, because sometimes you may have diseases that you just have to take a medication to minimize the chance of kidney stones. So we do a general screening with blood and urine, and go over it with the patient and try to monitor it to minimize the chance of them coming back.
Right. Well, Dr. Alanzi, I really appreciate you coming out today, letting us know all about kidney stones, what to do, what to expect, symptoms, and more. So thank you so much for joining us today.
Thank you, Chris, for having me.
All right. Well, don't go away. We have more when we return.